Good morning, ladies and gentlemen. Today we have another lectures on epidemiology, and public health of malocclusion and trauma for batch 23. Okay. At the end of the lecture, the student should be able to explain the public health concern of malocclusions, explain the public health concern of dental trauma, describe the public health approach in prevention of dental trauma. This is some of the malocclusions and the treatment with the treatment we have seen after. Epidemiology of malocclusions, actually countries' percentage of malocclusion. The Chinese children usually have 67.82% of malocclusions. Nigerian children about 84% of malocclusions, and Indian children about 19.4%. And in America, the white children have about 34% of malocclusions, and the black children of malocclusions. Prevalence of malocclusion is higher in developed when comparing to developing or underdeveloped countries. Malocclusion percentage relatively low in deciduous dentition. Normal occlusion is 55% in primary and 40% in mixed and 30% in permanent dentitions. Malocclusion proved to be different entity to define because individual perception of what constitutes a malocclusion problem differs widely. Right. As a result, no generally accepted epidemiological index of malocclusion has yet been devised. Right. IOTN. The index is used to determine those cases that most need treatment with braces so that limited resources can be targeted at those patients in greatest need, avoiding the provision of expensive and scarce treatment to mild cases. The dental health components, the aesthetic components. Sequelae of malocclusion, poor facial appearance, risk of caries, predisposition to periodontal diseases, risk of trauma, psychological disturbances, abnormalities of functions, TMJ problem, and TMJ. Rebus classification of etiology of malocclusions. You have these general factors. Hereditary, 2 is congenital, 3 is environmental. Under environmental, you have prenatal, like trauma, maternal diet, germ measles, or maternal metabolism. Then under postnatal, you have post-injury, TMJ, injury, and cerebral. And 4, you have predisposing metabolic climates and disease. Under that, you have endocrine imbalance, you have metabolic disturbances, you have infectious diseases, and under 5, you have dietary problems, nutritional deficiency. And 6, you have abnormal pressure habits and functional aberrations. Under abnormal pressure habits, you have abnormal sucking, you have thumb and finger sucking, you have tongue thrust and tongue sucking, you have lip and nail biting, You have tonsils and adenoids. You have improper deglutitions, abnormal swallowing habit. You have respiratory abnormalities. Maybe you breathe through your mouth instead of through your nose. Bruxism, okay, where you grind your teeth at night. And then you have 7, posture. 8, you have trauma and accidents. Okay. Under local factors, you have abnormal frenal attachment. There you see in the picture that causes the 2 anterior central incisors to be separated because of the low attachment of the frenal attachment. Abnormalities of tooth number, supernumerary or missing teeth, abnormal shape and size of the tooth, mainly for young children when they have their permanent teeth, which is much bigger than their face, and they have not developed the alveolus bone to cope with the tooth size. That's why there is an overcrowding of the tooth. Premature loss of deciduous teeth, prolonged retention and delayed eruptions, abnormal pathway of eruption, ankylosis, dental caries, and improper restorations. Role of public health professionals in preventing malocclusions. Health education for school children, parents and school teachers about the importance and knowledge of abnormal habits and its prevention. Preventive orthodontic, interceptive orthodontic, and orthodontic treatment. So that is the role of public health dentists. Okay. Under preventive orthodontic, we have this habit counseling. We have habit breaking appliances. We have space maintenance, and we have functional appliances. Okay. So we go through a little bit on the procedures undertaken in interceptive orthodontics. Okay. We have serial extractions, corrections of developing crossbite, control of abnormal habits, space regaining, muscle exercises, interceptions of skeletal malrelations, and removal of soft tissue or bony barrier to enable eruption of teeth. Huh? Okay, epidemiology of dental trauma. Dental trauma takes longer to treat and is more expensive than many other bodily injury treated on an inpatient basis. Dental trauma affects quality of life. An untreated dental trauma affects an individual 20 times more compared to those who have never suffered a dental trauma. The dominating problem was chewing, eating food, and school activities. The prevalence of dental trauma is still high worldwide. Statistics from many countries show that about 1/3 of preschool children is involved in dental trauma. 1/4 of school children, 1/3 of adults have suffered a dental trauma at least once during their lifetime, most frequent in first 10 years of life. Decrease gradually with age, rare after 30 years. This is due to they already can take care of themselves. Oral region consists of 1% of total body area, but Oral region consists of 1% of total body area, but it accounts for 5% of all somatic injuries. Around 30% at 5 years old in deciduous dentitions, between 10 to 67% at 12 years, permanent dentitions involved in dental trauma. Under gender, boys generally more often injured than girls. Male to female ratio is 1 to 3 or 1.3 to 2.3 to 1. It is some of the activities that cause dental trauma. You like it or not, this is what causes the dental trauma. Causes of dental trauma: falls, collisions, motor vehicle accidents. Okay, emotionally stressful states, non-nuclear family, paternal abuse. Okay, mobbing, epilepsy, cerebral palsy, hearing or visual impairment, sports, hits, assaults, MVA or RTA, road traffic accidents or motor vehicle accidents. Predisposing factors: alcohol, leisure, and lifestyle related. Recently, we heard a lot of cases where a driver under alcohol influence hit other road users, and actually not only injured them but it's already killed them. Prevalence of traumatic dental injuries to primary teeth. 5 years old. We have these few articles that was that has come out. Andresen and Ron, 1972, in Denmark. The percentage of male to female is about 35% to 25% is traumatic injuries to primary teeth, 5-year-old. Garcia Godi et al., 1983, Dominican Republic, 34% of male to 29% of female have traumatic dental injuries to primary teeth. Forsberg and Tadestam, 1990, Sweden, also have high prevalence of traumatic dental injuries, 28% male and 16% female. Sanchez and Garcia Godi, 1990, in Mexico, they only do the research for male, which is 40% male injury, traumatic dental injuries to primary teeth. Okay. Otuyemi et al., 1996, Nigeria. The figure is much higher, 36% male compared to female, 35% injuries. Al-Majid et al., 2001, Saudi Arabia, also have very high prevalence of injuries, is 33%. And Andresen and Ron, again in Denmark. This one is prevalent of traumatic dental injuries to permanent teeth. Andresen and Ron, 1972, Denmark. Male have a higher figure, 26% male as compared to 16% female. They have permanent teeth injuries. Garcia Godo et al. 1985, Dominican Republic, also mentioned that male have 80% prevalence of traumatic injuries compared to female, which is 12%. Hunter et al. 1990, UK, also have high prevalence of permanent teeth injuries. It reaches 90% in male to 11% in female. Forsberg and Tedestam, 1990, Sweden, you have 27% male prevalence of injuries and 12% female prevalence of dental injuries to permanent teeth. Otuyemi et al. 1996, Nigeria, which is much higher prevalence of dental injuries to permanent teeth, which is 36% in male and 35% in female. The highest that we have seen so far in female. Okay. Esa and Razak, 1996, Malaysia, about 3% in male and female. Okay. Al-Majid et al., 2001, Saudi Arabia, they have 34% of prevalence of dental in trauma to permanent teeth. Marcinis et al., 2001, Brazil, have 67% of prevalence to traumatic injuries to permanent teeth, which is very high. Trobet et al., 2003, again in Brazil, they only find out about 22% male and 15% female have prevalence of traumatic injuries to permanent teeth. This is some of the injuries that we can see. This is especially in young children. Okay, when they have sports injuries. The third one on the left, this may be injuries due to trauma due to accidents, motor vehicle accidents. Not only the teeth that is involved, but also the alveolus, fractured alveolus. But this one, also the two anterior permanent incisor being almost evolved. Classification of dental trauma, WHO classifications. Okay, include injuries to internal structures of mouth. Luxation injuries are grouped as one. Broad, open-ended group as other injuries, including laceration of oral soft tissues, which may be subject to misinterpretations. Alveolar and fractures of maxilla and mandible are classified separately as fractures of facial bones. Classification of dental trauma. Alice classification. Modification of WHO classifications. You have simplified the WHO classification. Subjective interpretation because it includes broad items like simple and extensive fractures. Misses-out injuries to alveolar, maxilla and mandibular fractures. Most frequent types of dental trauma. Uncomplicated crown fracture without pulp involvement. Okay, that is much easier to treat. Luxation of teeth. Frequent teeth affected. Frequent teeth affected will be the maxilla central incisors. maxilla lateral incisors, and mandibular central incisors. Predisposing and risk factors. There is gender. We find that males are more exposed to trauma than the females, but in certain countries, the female also have a high prevalence of trauma to permanentive. Large maxillary overjet with incomplete lip closure. 1/3 of injuries occur among those with malocclusions, especially the class 1 overjet malocclusions. Okay. Lower socioeconomic groups, previous experience of dental trauma, and lack of mouth guards or face guards in certain spots. Knowledge among communities and professionals, caregivers, in how to act at the scene of a dental trauma is scarce. Many people lack knowledge. Children and adolescents, parents, physical trainers and active sportsmen, school and physical teachers, acute medical staff at emergency centers, medical students, doctors, school nurses, fire brigades, ambulance personnel, lay people. Correct and sufficient information about dental trauma in first aid textbooks and manual is lacking. Prevention. Orthodontic treatments to correct malocclusions. Okay, mouth guards while engaged in contact sports. Appropriate helmets with chin guards while cycling. Health promotion through enabling factors such as safer playground designs, safety design in school and home environment to prevent or minimize falls of their effects, etc. Education on emergency management to parents, teacher groups, carriers in kindergartens and nurseries. National Oral Health Plan for Malaysia 2011-2020. Okay. The app and dental trauma is a dental first aid app which is endorsed by the International Association of Dental Traumatology. This app can be found in IADT homepage on App Store or Google Play. This you can open up this app under IADT homepage and goes into under dental traumatology. So you can understand what the dental trauma is, what kind of dental trauma, and basically what can be done to reduce and to treat the after effect of dental trauma. So this is playing rugby with a mouth guard. This also playing rugby with a face mask and a mouth guard. This is samples of mouth guards that can be done by the dental technicians or dental technologists. Okay, now I want to do a little bit on cleft lip and cleft palates, which I find it may be interesting to know. This is some of the unilateral cleft lips and cleft palate that we can see. Okay, cleft lip and cleft palate can be unilateral, can be a bilateral. Orofacial clefting. Cleft lip and cleft palate are both defects that occur when a baby's lip or mouth do not form properly during pregnancy. The lip forms between the 4th and 7th weeks of pregnancy. As a baby develops during pregnancy, body tissues and special cells from each side of the head grow towards the center of the face and join together to make the face. The cleft lip happens if the tissue that makes up the lip does not join completely before birth. A cleft palate happens if the tissue that makes up the roof of the mouth does not join together completely before birth. Epidemiology. In about 1 in every 1,600 babies is born with cleft lip, with cleft palate in the United States. About 1 in every 2,800 babies born with cleft lip without cleft palate in the United States. About 1 in every 1,700 babies is born with cleft palate in the United States. Causes and risk factors. Causes of orofacial cleft among most infants are unknown, may be caused by a combination of genes and other factors. Example, women who are smoking, diabetic, and taking some medication during pregnancy. Management and treatment. Services and treatment for children with orofacial cleft can vary depending on the severity of the cleft, a child's age and needs, and the presence of associated syndromes or other birth defects or both. Surgery to repair a cleft lip usually occurs in the first few months of life and is recommended within the first 12 months of life. Surgery to repair a cleft palate is recommended within the first 18 months of life or earlier if possible. Surgical repair can improve the look and appearance of a child's face and improve breathing, hearing, and speech and language development. With treatment, most children with orofacial cleft do not do well and lead a healthy life. Conclusions. The prevalence of dental trauma is still high on a high level worldwide. The dental trauma affect quality of life. Dental traumas are costly and time-consuming to treat. Dental trauma events often occur outside of his time, which may result in a worsened prognosis. The knowledge about how to act at the scene of a dental accident is of major importance, especially concerning evolved permanent teeth. The IADT guidelines and the Dental Trauma First Aid app are of great help to inform about how to professionally treat a dental trauma and what to do at the scene of accident and later. Okay, thank you for your time and thank you again for listening to my talk. Thank you very much.